So I want to welcome everyone to the test number 2 study guide review for advanced pathophysiology. We'll go through each of the sections, and then if you have any questions, you can just ask. This is kind of a heavy content chapter, um, but hopefully you have some basis for some of this information to begin with. But we'll go over chapter number 3 first. You'll need to know, and this kind of goes with the CBC components, but just know what the different CBC components are and what they mean. When we talk about leukocytosis, think about the things that can cause leukocytosis. Infection is always one of them. Sometimes it can be a stress reaction, and sometimes you can get a false leukocytosis from steroid use. So just kind of keep those things in mind when you're thinking about leukocytosis, that it may not always be an infection. Be familiar with Neupogen and what that does, how it works. And obviously we use it for patients who need bone marrow stimulation, or we use it in chronic kidney disease patients or chemotherapy patients. Be able to identify and tell the differences between iron deficiency anemia, chronic blood loss anemia, and pernicious anemia. I would just know the underlying reasons for each and what that might look like blood work wise. There is 1 or 2 questions on the Hodgkin's lymphoma. Again, remember when we're talking about diseases, you're talking about signs and symptoms, possible treatment options, and the pathophysiology of whatever the disease is. We'll also talk about myelodysplastic syndrome and sickle cell anemia. Remember with sickle cell anemia, those patients, just understand how that happens. They get the sickling in their peripheral tiny blood vessels. So that's what causes them the pain when they're having a sickle cell crisis. And the ways we treat that are with hydration and pain control. And one of the sickle cell emergencies is if someone is having a crisis and they have chest pain, that's a medical emergency for them. They usually, you won't need to know this, but they usually need some type of plasmapheresis to remove the sickled cells from their blood. For signs and symptoms of anemia, I want you to think about things like, what would someone look like if they were anemic? They may have a pale color. They may get lightheaded and dizzy. They may have some palpitations, shortness of breath. Think along those lines, like not what is anemia, but what does someone look like who has anemia? When I'm talking about the blood type comparison, that's what I want you to know, things like who's the universal donor, who's the universal recipient. And we talked a lot about the pathophysiology of conversion of prothrombin to thrombin. Prothrombin, sorry, it's the end of the day. Prothrombin to thrombin. So just understand how that works, because you'll need to understand that as well when next semester you learn about anticoagulation medications. When we're talking about foods that affect the anticoagulation cascade, that is, I want you to think of along the lines of like Coumadin. So you need to tell folks to be careful with their green leafy vegetables. That's the big one. We do not recommend that people avoid green leafy vegetables anymore. What we recommend is that they eat a consistent amount of green leafy vegetables. So if they're always going to have 1 salad a day, they always have 1 salad a day, and that will help keep their Coumadin levels more consistent. And hemophilia, I want you to think about the presenting signs and symptoms. One of the classic questions for hemophilia is, you're a nurse practitioner working in the ER, and a child comes in with lots of bruises on them, and that's kind of their first sign or symptom that they have. You automatically think that it might be child abuse, but it could be hemophilia as well if there's, no concerning background symptoms. So does anybody have any questions on that? Okay, let's move down a little bit. Cardiovascular, that's always the big one. We got the big systems this test, but you want to know about atrial fibrillation. What are the risks associated with atrial fibrillation? Obviously, the big one is stroke. What are some general treatments and signs and symptoms of that? We talk about hypertension and some of the risk factors. Remember, when we talk about risk factors for cardiovascular disease, it's always going to be, obesity, smoking, a poor diet. Specifically for hypertension, African American people are more likely to develop hypertension earlier in life. Then moving on, just be familiar with the basic cholesterol levels, like what LDL is and what HDL is. For temporal arteritis and Kawasaki's disease, just have a general idea again of what they are and the presenting signs and symptoms and some basic treatments. For the signs and symptoms of a myocardial infarction, think about that the heart is not getting enough blood. So what are the symptoms that you would see? That is the chest pain, shortness of breath, pain. Some people have back pain, neck pain, but always remember that in a woman, they have different signs and symptoms. So anything on the waist up is chest pain until you determine that it's not. And you may determine that just by questioning them. Do you know what I mean? But you always need to be thinking in the back of your head, could this woman be having myocardial infarction? Remember that older folks and diabetics will also have different symptoms of a myocardial infarction. There is actually no EKGs to specifically identify, but just kind of know the basics about what's happening with normal sinus rhythm, atrial fibrillation, ventricular tachycardia, and premature ventricular contractions. There's some basic questions about like what's happening during that. Lifestyle recommendations for patients with coronary artery disease kind of goes back to controlling. There's a chart in your book that has the modifiable risk factors and the unmodifiable risk factors. That's what we're talking about with that. So that's, the low salt diet, exercise as tolerated once they've been cleared from a cardiac standpoint, taking your medications on a regular basis. Angina, just understand what it is and what are the signs and symptoms. Be familiar with what a physiological murmur is. People with physiological murmurs are often someone who is, you might find them in a pregnant woman, and you might find them in somebody who has a very high blood pressure. And that physiologic means that they're not actually problems with the valves. It's a problem with it's a problem or an alteration in the physiology somehow. So then, like once you're pregnant, you don't have this heart murmur anymore. Or once your blood pressure is under better control, you don't have this heart murmur, you don't have that murmur anymore. The grading of heart murmurs, we didn't actually, that wasn't actually in our presentation, was it, the grading of heart murmurs? I don't believe that it was. So X the grading of heart murmurs, because I think Professor Delpree will cover that in assessment. So I'll take that out because I was just thinking, I'm like, we didn't go over that on this side. You want to be able to distinguish between a bioprosthetic valve and a mechanical valve. The bioprosthetic valve is it's basically an artificial valve from either a cow or a pig, something like that. They have a shorter life expectancy, but the mechanical valve has a longer life expectancy, and mechanical valves are the metal valves, but you need to be anticoagulated with them. So which one you use just kind of depends on the patient, but those are the major differences. With the bioprosthetic valves as well, you also don't have to be fully anticoagulated with those. They might put you on anticoagulation for a few weeks, but it's not a continual needed option. When you look at the heart sounds, S1, S2, S3, and S4, just be aware of what is happening within the heart at each of those different times. Not necessarily how you hear them, but when you hear them, what does that represent? CHF, that's something you'll see a lot. But again, what is it? What happens? The signs and symptoms, lifestyle changes and medications, and the risk factors. The RAAS system, that is in cardiovascular and in the kidney part, but what is it and what is its role in blood pressure control? And that will be very important, again, to know. You'll use that again when you start learning about different medications that control blood pressure. When we talk about DVTs, you want to understand what is it, what are the associated risk and the disease associated risk. So associated risk for DVTs include recent surgery, especially orthopedic surgery, trauma of any type. Hospitalization in and of itself is a risk factor for a DVT. And then who can tell me what the big disease associated risk with a DVT is? Why do we anticoagulate people with DVTs so they don't get what? Does anybody know? Pulmonary embolisms. So blood clots in the legs are 9 times out of 10 the causes of pulmonary embolism in the lungs. You want to be able to understand a little bit about what stasis dermatitis is and how to distinguish a venous ulcer from an arterial ulcer. There is a chart in that in your book as well. So removing the grading of the heart murmur and how to diagnose them, are there any questions about the cardiovascular function? All right, I'll move along then. With the pulmonary function, that's chapter 5. Pardon me one moment. Do you mind, do you guys mind giving me 1 minute? I have a child screaming. I will be right back. I'm sorry. So chapter 5 really specifically focuses a lot more on the disease and the pathophysiology of it. So when you're looking at these like aspiration pneumonia, again, understand what that is and the signs and symptoms. The job of erythropoietin, that kind of goes back to our chapter 3 question with the Neupogen. That all kind of goes together. A VQ scan is just understand what that's used for. That is used, the gold standard to diagnose pulmonary embolism is a CAT scan, but if someone has a suspected pulmonary embolism and can't have a CAT scan, a VQ scan is what would be ordered. All you really need to know for the test is that a VQ scan is ordered to rule out a pulmonary embolism. Understand what hypercapnia is. And then again, pneumonia, acute sinusitis, epiglottitis, lung abscess and cor pulmonale, asthma, COPD, sleep apnea. Those are the basics behind the pathophysiology of them, the signs and symptoms and possible treatments. The pneumothorax, you want to know the different types and the different treatments of them. Does anybody have any questions on chapter 5? Okay. And then as far as chapter 7 goes, on the very first page of the chapter, there's a diagram that shows the nephron parts and function. That's important to understand. You want to have a brief idea of what the process for urine formation and excretion is. Be familiar with figure 7.2 on page 291. The different types of incontinence. A neurogenic bladder. Neurogenic bladder comes usually from a spinal cord injury or spinal stenosis, significant spinal stenosis where you can't empty your own bladder. Know the difference between cystitis and polynephritis. Nephrolysis and the type of kidney stones is, that table is 7-3, page 305. Know the basics of what a Will's tumor is and the basics of renal cell carcinoma. Bladder cancer focuses on the risk factors associated with bladder cancer. Like what are the things that we do in our life that make us more susceptible to bladder cancer? It's one of those things like smoking is always the answer, and smoking is always the answer for a high risk of bladder cancer. BPH, again, just the basics behind it. Polycystic kidney disease and chronic kidney disease. When you look at chronic kidney disease, you want to kind of understand how it develops and what happens. Some people, it happens more rapidly because of polycystic kidney disease, but in people who have underlying conditions, if you have high blood pressure that's untreated for a long period of time, that can make you more susceptible to chronic kidney disease. And as you get older, your kidneys just don't work as well. So patients will say, I never knew I had chronic kidney disease, but they've had it for years. But it's all just part of their normal aging process as well. So I am almost done with the lectures on these two topics as well. So if there's any other, if you have any questions after you look at that or looking at this, you can let me know. Does anybody have any questions at all related to the test review? You okay? And Yadir, are you okay? I can't see you.
Yes, I'm okay. Thank you.
Okay. Hello.
Hello.
I just wanted to make sure you're okay. You don't have to keep your camera up.
I have my dogs barking around.
Oh, it's okay. I've got kids running around. It's okay. All right. Well, if you don't have any other questions, that is going to end our test review.